My name's Dustin Cole. I'm going to be doing the pediatric assessment today with my nephew Logan. All right, the first thing I do before I enter the room is perform hand hygiene. So I'm going to spray some hand sanitizer on me. You want some hand sanitizer? All right, spray some hand sanitizer, rub them together. The next thing I would do is identify the client. So what's your name?
Logan Noss.
Logan Noss. Okay, good. I would compare that to the band on his arm in a hospital setting. I'm going to assess for level of consciousness. He's clearly alert and awake because he can respond to my questions. I'm just going to ask him some questions for orientation. So, what grade are you in?
First grade.
First grade. What day of the week is it?
Wednesday.
Wednesday. And what year is it?
2021.
Exactly. Excellent. So he's awake, alert, and oriented. So my priorities for the pediatric assessment are going to be breath sounds, heart sounds, bowel sounds, to assess his work of breathing, collect vital signs, but I'm going to save, if I was taking in a blood pressure, I would save it towards the end. So if they get, antsy or anything, then it'll be closer to the end. So I'm also going to assess pain, and if he was in the hospital, I'd assess IV and surgical sites, and I would also, in a hospital, perform a focused body assessment on what they were admitted for. So the first thing I'm going to do today is I'm going to get an apical heart rate, and I would listen for an apical heart rate for a minute. So I'm going to do that. All right. Just going to listen to your heart. All right. Right there. I'm just going to listen for a full minute. Stop moving. All right. Okay. All right, so his heart rate is 70 beats per minute, which is in normal ranges. I'm going to assess his respirations, and I would count them for a full minute. I'm only going to do it for 15 seconds just for the sake of time. So I'm just going to change my watch face here. All right, and just breathe normally. All right, his breath sounds, his breath respirations would be 17 per minute. Like I said, I would wait to take a blood pressure till closer to the end if I was taking the blood pressure today. I'm now going to listen to his breath sounds. So I'm just going to listen to your breath sounds. All right, buddy? Take a deep breath for me. Another one. All right, right here. Right here. Okay. Another one. One more. Good job. All right. I'm also going to listen to 6 places on his back. Can you sit forward for me? Deep breath. Deep breath. Okay, one more. Excellent. And you can just breathe normally now, buddy, okay? All right. I'm also going to listen to his lung sounds laterally. So can you lift this arm up for me, just so I can Get under here and take a deep breath. And this one over here. All right. So his lung sounds are clear, no sounds of any crackles or abnormal sounding lung sounds. I'm also going to listen to his heart. So, okay, I'm going to listen to your heart. All right, so I'm going to listen right here to the atrial. I'm going to move over to the pulmonary and go down to the Irvis point. All right, tricuspid and the mitral. At this time too, I could get an apical pulse as well, and I would listen for a full minute to that as well. Okay. And then while I'm here, I'm going to listen to his vowel sounds. All right. So his vowel sounds are normal active. His heart sounds are S1 and S2 are present, and there was no sound for any murmurs. I'm just gonna palpate your stomach real quick, I'm just gonna press on it, okay? I don't feel any mass or distension. Okay, no mass or distension. His vowel sounds were normal active. Are you in any pain right now?
No.
All right,
not really.
that's good. He has no surgical incisions or an IV site, so I can't assess that, but I would be looking for like infiltration, signs of infection. I'm going to take his radial pulse. So I'm just going to test this one. Can I see this one too? All right. They're equal bilaterally. Strength is +2. Okay, I'm going to need to get his peripheral pulses. All right, thank you. All right. All right, that's good. All right, peripheral pulses are equal bilaterally, a +2. The next I'm going to do capillary refill, so I just need to pinch your finger, buddy. Can I do that quick? Okay, capillary refill is good. Refills less than 3 seconds. Same with the toes, less than 3 seconds. All right, skin is normal color. Skin color is even throughout, and he feels warm. His skin is dry. There's no edemas or rashes that I can see. Next, I'm going to try muscle strength. I'm going to have you push me. Let's see if you can push me over like you said you could. Good. Good. All right. So now I'm going to have you pull. All right. Oh, Jesus. Strength is good in the arms. All right. Now push with your feet. Push up. Good. Now pull back. Excellent. All right. So muscle strength is good in both arms and legs. I'm going to get up and have you walk around. And I'm just going to have you, can you do that dance you were doing earlier for me? Okay, excellent. Go ahead and sit back down. So his gross and fine motor skills are good. He has good posture and gait. His mobility and his muscle tone's good, and his muscle strength is good. His range of motion is good everywhere. And his movements are symmetrical. So the next thing I would ask is, I would ask the parents about the appetite. Well, I can ask you about the appetite. What's your favorite food?
Butter noodles.
And do you eat that? Do you eat every night?
No.
No? You get hungry? You eat when you're hungry? Okay, good. So he has a good appetite. And I would ask the parents if he's tolerating the diet. Voiding patterns, I would ask for amount, frequency, color, clarity, and odor. I would also ask for bowel frequency, consistency, and amount and odor. I think I would ask, all right, that's everything. That's the end of this pediatric assessment. Thank you for watching. Have a great day.